Hi, this is Curtis Alexander, and let's get right into it. Today we're going to be talking about Prilosec side effects. If you find this video helpful, thumbs up, subscribe would be appreciated. So, Prilosec, very, very popular drug, available over the counter now, also goes by the generic name Omeprazole. So, the side effects on Prilosec are kind of interesting. At face value, the side effect profile is pretty low. So, we have HA or headaches occurring in studies up to 7% of people, stomach pain up to 5%. And then we have some of the other, what I would call stomach or gastrointestinal side effects, nausea, diarrhea, so forth. Very well tolerated drug in that regard. I did want to point out, if you experience diarrhea with Prilosec, it's important to pay attention to that because there is a risk of developing Clostridium difficile. You'll see the doctor, nurse referring to it as C. diff. They can test for this, but do keep an eye on the diarrhea. That can be a sign of something more serious going on. But by and large, Prilosec is pretty well tolerated. Now, backing up to, there's some controversy around it. Does it make sense to take Prilosec? Well, I don't want to get too deep into the weeds. Usually, if you have reflux of any kind, it's a sign of some other issues going on, namely your diet's not good or you're overweight. Those are the two things I see with people who need to take Prilosec. Most people don't want to hear that. They don't want to hear that they have to address diet the right way and lose some weight. So they take Prilosec. Now, throwing those things to the side, let's look a little deeper at Prilosec and some of the other side effects people don't talk about. So we have pneumonia, and you're looking at Prilosec, it's like it acts on the stomach. How could there be a risk of pneumonia? And just so you know, you'll read about this online, and there's a lot of controversy. I've personally seen it. Doesn't mean it's going to happen a lot, but it's more important for you to understand why it's happening, or why we think it's possibly happening. Namely, Prilosec goes into your body, and it's called a proton pump inhibitor. Basically, that's a fancy way of saying that there's these little pumps in your stomach, and it secretes acid. Well, Prilosec blocks that acid secretion. So you have your stomach, and then you have your esophagus connecting to it, and in between those two is a valve. That valve is normally closed because it's trying to protect the acid from going up into your esophagus, which makes sense. But when the acid goes down, because you're taking something like Prilosec, that valve can relax because it sees that the acid isn't as high. And what you can get is some of those stomach contents going up into the airway and possibly getting into the lungs. So people think of, oh, I've got reflux, I got to get this acid down. Acid's not a bad thing. You want a high acid content in your stomach. That's how our bodies are designed to work. When you knock that acid down, you do run the risk of aspirating stomach contents into your lungs. If it gets into your lungs and grows, you can get an infection or pneumonia. Not saying it's common, but I have seen it, and it's been reported in the literature. So it's something to be aware of. Okay, how about weight loss and weight gain? Well, obviously, there's a couple different ways we can go here. Again, let's look at how Prilosec acts. It lowers stomach acid, so you can experience, you're not digesting food completely, so you're not absorbing nutrients, so there can be weight loss. And again, if we look at the normal side effects, a lot of them are stomach related. They don't happen a lot, but if they do, you're going to tend to see some weight loss more likely than weight gain, at least in my experience. But by and large, the people that are on it tend to be a little overweight, which is part of the problem as to why they're getting the reflux in the first place. My rule of thumb, and very few docs or people follow it, is the proton pump inhibitors as a whole, not just Prilosec, are designed to be given the lowest dose for the shortest time possible. But what happens is people start on it, it relieves the pain that the reflux was causing, so they stay on it longer than they probably should be. Again, that's talk between you and your doctor. I'm just telling you that yes, it can temporarily help out, but you really want to be thinking about the root cause of what's causing the reflux. And most people say, well, I've changed my diet, I've done this, I've done that. Most people I find when I dig deeper, they really haven't. They think they have, but they're not addressing it in the right way. So at any rate, that's what some of the more common known Prilosec side effects. And then the pneumonia part is something you want to think about as well. Again, it's a class of drugs. It's a drug that's helpful when used the right way. You just have to make sure you're using it the right way. So again, Curtis Alexander, hope the video was helpful. And until next time, we'll talk to you then. Any questions, just leave them in the comments. Thanks.